I'd like to start by just having everyone's perspective on what occurred back at the beginning of the COVID-19 pandemic in the first wave, and how your respective institutions or organizations really responded to that. I think it's probably a good place to start, just to see where we came from at the beginning of the year. So, Dr. Baldini, if you'd like to start, perhaps.
Yeah, sure. So yeah, at first we clearly had two different managements between the first and the second wave. Clearly, one of the main explanation is that we didn't have time to prepare for the first one, obviously. So it was the wave was pretty harsh, and we had to adapt very rapidly. And I think that was the main challenge that we had to dealt with. We immediately at that time took some simple measures, but important ones. With especially at Gustave Roussy, we had restricted access for caregivers. That was one of the first, and mask for everybody. And then we had also to cancel monitoring visits and to put them on remote. And also we did a teleconsultation. So that was the first measures that we took, actually. Then when talking mainly about phase 1 trials and early phase trials, it was clearly challenging, but we still continued to enroll patients in our early phase trials. We had almost 90 patients enrolled during this 3 months of the first wave. So we were very happy not to stop enrollment. We decided to test all patients before starting the trials with a COVID PCR. And we tried to cancel some biopsies, especially lung biopsies that are probably at increased risk of complications. So that was actually the main measure that we took at first for our patients. So really the idea was not to stop enrolling patients, but adapt. Obviously, I can also talk about some treatments that were delayed.
Mm-hmm.
Usually it was not during the DLT period. So the DLT period is usually for the one that are not accustomed to that, but it's usually the first months of the early phase trials, and you are really looking for toxicity of the new drug. So it's usually quite it's an important time for investigators and patients, so and resource consuming. So most patients obviously were not delayed when starting the DLT period. But then we tried to delay patients that were under immune checkpoint inhibitors, for example, in early phase trials for a long time, for more than a year. So we decided to delay some treatments.